Have you ever wondered how much air your lungs can actually hold?
In this video, we're going to look into the mechanics of breathing using this graph to break down respiratory volumes and how they combine to form different lung capacities. Understanding these terms is essential because they're used clinically to evaluate lung function with tools like spirometry. Let's start with the four basic volumes shown in Figure A, the dynamic tracing of breathing. Tidal volume is the amount of air inhaled or exhaled during normal, quiet breathing. At the top of the wave is a normal inspiration, and the bottom is a normal expiration. In an average adult, this is about 500 milliliters per breath. The inspiratory reserve volume is the extra amount of air you can breathe in after a normal inspiration if you take a deep maximal breath. On the graph, this is the peak capacity above the normal breath, often around 3,000 milliliters. This is the volume you use when you take a huge breath in before diving underwater. The expiratory reserve volume is the extra amount of air you can forcefully exhale after a normal exhalation. It's typically about 1,100 milliliters in adults. The residual volume is the air that always remains in your lungs even after you've exhaled as much as physically possible. This volume is crucial. Think of it like a tire that's never fully flat. This remaining air, around 1,200 milliliters, keeps the alveoli inflated, preventing the lungs from collapsing completely and allowing for continuous gas exchange between breaths. Residual volume cannot be measured by standard spirometry. Now that we've defined the four fundamental building blocks, the volumes, let's look at the right side of the image, Figure B, where we combine them to form the four respiratory capacities. The inspiratory capacity is the tidal volume plus the inspiratory reserve volume. It represents the maximum amount of air you can possibly inspire after a normal expiration. The functional residual capacity, or FRC, is the expiratory reserve volume plus the residual volume. It's the amount of air remaining in the lungs after a normal, quiet exhalation. FRC is important because it serves as the stable, large air reserve for gas exchange between breaths. Vital capacity is tidal volume plus inspiratory reserve volume plus expiratory reserve volume. It represents the maximum amount of air a person can move in and out of the lungs in a single maximal effort, from full inspiration to full expiration. This is the volume most often measured clinically to assess overall lung strength and function. Total lung capacity is the sum of all four volumes. It represents the maximum amount of air the lungs can hold. For an average adult, total lung capacity is approximately 6,000 milliliters. Here's why this matters clinically. Lung volume measurements are essential diagnostic tools because different disease states drastically alter these volumes. Obstructive diseases like COPD or severe asthma trap air, causing an increase in residual volume and subsequently total lung capacity. The air can't get out. Restrictive diseases like pulmonary fibrosis stiffen the lung tissue, mechanically reducing the ability to expand, which severely decreases vital capacity and total lung capacity. The lungs can't get big enough. Spirometry and lung volume measurements don't just measure air. They help clinicians diagnose, classify, and monitor the progression of respiratory conditions. So remember, the volumes are the building blocks. This is the tidal volume, inspiratory reserve volume, expiratory reserve volume, and residual volume. Capacities are combinations of these volumes. So inspiratory capacity, functional residual capacity, vital capacity, and total lung capacity. Measurement of these values provides a clinical snapshot of the patient's overall lung function.